Hey everyone, welcome. It's Angela Love-Zarenka with Lactation Education Resources. Very happy to introduce Nikisha Killings and Nikki Hunter Greenaway to talk about our subject today, which is vaccine vacillating. Nikisha, Nikki, thank you.
Thank you. I'm glad to be here once again. Wow, this has been a crazy day. So my head is like spinning. I'm trying to land in this conversation. I'm vacillating, y'all. I'm all over the place. But welcome to another Nikki and Nikki Live. We're super excited to be here. I am Nikisha Killings, private practice lactation consultant and equity strategist for both LER and outside other organizations. In LER, my title is Director of Equity, Inclusion, and Belonging. And we're so thankful to LER for making this conversation possible today. I'm joined by my co-good troublemaker, Nikki Hunter Greenaway.
Hello, everyone. I am Nikki Hunter Greenaway, also known as Nurse Nikki. I'm a board certified family nurse practitioner and an IBCLC with a private practice in New Orleans, Louisiana. And I'm the co-good troublemaker and founder of Nikki and Nikki. So thank you for being with us today. We know this is a hot topic and we thrive off the hot topics. And we both have our tea here because we're about to spill the tea. Now, I think we should just dive into it. And please, we want to hear how y'all are doing. Let's do a quick check-in.
Sure.
Things are ever changing in everyone's lives. So let's do a quick check-in. Like I said, I'm in New Orleans. It is Mardi Gras season here, y'all. So happy Mardi Gras.
Thank you.
Yes.
Is that the response?
Yes. We are in it. There are no parades or anything like that, but that doesn't matter. Folks are still coming to New Orleans and increasing
For what?
our COVID rates because they figure like, oh, y'all got bars. Our bars, you can't even drink in our bars because they're barely open. We are in phase 2, as our mayor says. And it's kind of frightening because this is how, we led the way with New York when this all started, and it all started from Mardi Gras. Now, mind you, we don't have half as many people here, but we do still have a very full Bourbon Street on any given night. Still tons and tons of parties where people aren't wearing masks, and obviously they're not distanced. And then a lot of families have taken it upon themselves, which is a great idea, to turn their homes to decorate them like floats. So, and it's beautiful.
Oh, that's
but
really cute.
It's bringing a lot of tourists, and tourists that come from places that masking may not be a priority.
I know
so
places like that.
Yeah, I mean it's kind of east of here, down. Starts with an F. So that's a little scary for someone like myself, who's out here trying to provide care in these COVID streets. So that does give me pause. But other than that, we are healthy and well, and that is to be thankful for.
Indeed.
So,
Same. I still in Florida, and the beaches are still open, and so are the bars. And now Bike Week will be happening as normally scheduled. So we'll have lots of bikers down here, as if Bike Week that happened in the Midwest back in the fall wasn't an indicator enough of how super spreaders, whatever. So that's happening. And we are continuing to try to stay safe as much as humanly possible here. And we're in no phase in Florida. So all things are open. People are moving about as they normally would, masked or unmasked. And that makes enjoying this new place that we live really difficult because we would rather seclude. So that's where we are as a family. And our kids are, I don't even know, after this year, who knows what expectations they will have about interacting with the world. I think they've become so used to now just being in our little nuclear family that it's going to be interesting to transition out of this mode. And that'll be another Nikki.
Yeah.
in
Yeah.
the future in
Moving on from
2030.
COVID-19.
I don't know when that's going to happen. Yeah. So
Right.
anyway, we are well. I won't complain. You all have heard my spiel about Florida. Really happy to just be healthy at this point and continuing to pursue practice in whatever way that looks in the moment. And we will talk to you more about some of that as time continues to go on. All right, so that's my check-in. How are you all doing? Angela, are we hearing anything from the audience, where they are, how they are? It's really cold here, and I know that's relative. It's relative, but
Did you say
I'm
it's
all,
cold in Florida?
listen, business on the top and fuzzy socks on the bottom. It is cold here in Florida to me. I like to have the heater on. I know y'all, it's relative now. So it's probably a nice balmy spring day to most of you all here, but yeah.
Well, if it's any consolation, we have people who are participating from New York City, so tons of snow there. We have somebody else who is in a blizzard right now. Someone is in sunny Southeast Michigan, cold but sunny. Restaurant just opened at 24%. Oh dear, it's cold in Los Angeles too. It's 55 in
Oh,
Los
That's cold.
Angeles.
That's what it feels like here. Yeah, that's freezing. Yeah.
But it's mild in the UK, so shout out from Great
yes,
Britain. We've got
yes.
Southern California, Western North Carolina, Middleton, New York, 2 feet of snow this week, and it's about 30 degrees. Toronto, Canada,
Oh no,
shout
we
out.
yeah,
I'm
that's
sorry.
cold.
I'm sorry we offended you. I'm sorry. Canada.
They're
Yes,
just
Like,
laughing at us in Canada.
yeah.
grateful that their family is healthy in Southeast Florida, but chilly.
Mhm.
A volunteer vaccinator checking in Northern Virginia.
Oh,
Uh,
thank you for your work. Wow.
got another Lynchburg person, 4 inches of snow. Oh, New Jersey, Northwest New Jersey got 31 inches. Somebody from New Orleans, Pacific
Oh.
Northwest, unusually sunny day. Oh, I'm loving this. Rainy in Germany, 37 in
Oh, hello
Nashville and
from Germany.
sunny.
That's
Chicago,
fantastic.
Cincinnati. Wow. Somebody in LA says LA just returned to open outdoor dining while daily COVID deaths are averaging 200 a day.
Yeah.
Mm,
Yep. Yeah.
So, and
Yeah.
we
that
have
is.
another person who is volunteered with the Medical Reserve Corps this morning at the health department and
Fantastic.
vaccinated a bunch of people. So lots of
Wow.
people from all over the world. Oh, here we go. Sunny in New Zealand, another continent.
Oh,
Oh,
nice.
look it.
It's
Listen,
warm in
we're
New Zealand.
worldwide.
Y'all are
Listen,
everywhere. Y'all have reach. Oh my
Y'all.
goodness.
they're
Thank
coming from
you.
far and wide to hear this topic today, Nikki. It's a global issue. Everybody wants
It
to know.
is. It
Yeah.
is. And I will say that we were, I think, not all over the place, but just like I'm like have a lot of energy about this topic.
Yeah. That's a good way to
um
put it.
and yeah, and I want to make sure um we do want to make sure we have a respectful conversation, and we do want you to know that we want voices to be heard and opinions and things like that. But one thing we stand on are evidence and facts. And that's one thing that we strive to give you throughout this entire time since we started this journey, is stating, giving you the facts and things like that. So let's dive into the facts. All right.
Yeah.
So the COVID-19 vaccine, as you know, there are two vaccines. There's the Pfizer and there's the Moderna. All right.
So far.
So far, oh, Johnson and Johnson is putting that. So the new information that just came out is that Johnson and Johnson may release theirs for emergency use in the next 2 weeks. Okay. Um, just as an aside, if we didn't trust Johnson and Johnson to make powder, I don't know about no vaccine, but that's just my personal
That's
opinion.
just look up Johnson Johnson and talcum powder.
Right.
You'll know what that's about. Yeah. Uh-huh.
Um, so we have two in a possible, right? And so we have those two vaccines. They're being distributed across the United States. The rollout is different in different states, so you have to contact your health department to see which one, or where you can go and which category you fall in. Here in Louisiana, we are not phase 2, but we're on tier 2, where some places are just still in tier 1A, which is your healthcare providers and things like that. But the vaccine is what we call an mRNA vaccine. And it is quite different than any of the other vaccines that we've seen before. It uses what we call smart technology. It's not something, I know one of the things that we get a lot of is, this just came out, I don't trust it because it rolled out too fast.
So fast.
So fast. Here's the thing. It's actually been out a very long time. Longer.
The technology has.
The technology has been out for a minute. And so when we think about things, some things happen in the background of other things happening. We were just living life, and this technology was being designed. It's almost been out for like 10 years. And so now we have a chance to really use it. And what we did was, all the processes that a vaccine goes through, the trial, the paperwork and all that, that was kind of pushed and said, hey, we're going to rush this. We're going to put aside all our other projects, and we're going to laser focus on this. And that's what, it wasn't sped up. The whole research and thing wasn't sped up. It was, we're going to put everything else to the side and focus on this, because it was national problem. It's an international issue, and we wanted to make sure that it was out there and done correctly. So
I'm going to jump in here. So I think that this is what we see happening, what we have seen happen with the development of this vaccine, is what can happen when capitalism is put aside for humanity, for the better good. And so all nations, everyone who had capability to develop vaccines, shifted their focus, is what Nikki's saying, shifted their focus to creating a solution for this virus, because we knew it was a global issue that was going to have the potential to be devastating, and it has been. And so if you think about the power of everybody working on their own vaccines for various different issues and having various priorities, all shifting and putting all energy toward one solution, look at what can happen. You can get a vaccine in a matter of window that goes from this wide to here, this wide. It can happen really quickly if you have no bureaucracy, no red tape, no legislation you have to go through. You just have all the energies put toward finding a solution, and science is allowed to happen. This is what the answer can be. It's a statement, really, about what we're able to do, but what we often don't do. And when you think about all the diseases we're still working on vaccines for, or those that took decades to create, compared to this, it shouldn't be a statement against the COVID vaccine. It should, however, be a statement against what we've been doing, what it become commonplace. I'll let you finish.
Absolutely. We do not get paid by Pfizer, Moderna, or anybody else to give you this information. We are just passionate about this, and I personally have had, family deaths from coronavirus, and it's something that in my family, they've Nurse Nikki, as my family does call me, hey, we need some information about this vaccine because we're tired. How can we get in front of this? How can we help with this? And so I've took it upon myself to learn as much as I can from the evidence that we've been given about what's going on. So the mRNA vaccine does not have the live virus. I don't know how many times. It does not contain a live virus. It does not contain a weakened version of the virus or anything like that. It takes it a step further. It contains instructions for that. You know how you see the coronavirus and it's like a sphere, and then it has those little spiky things on the outside? Those called spiker proteins. It contains instructions for that spiker protein. Okay.
Grounds.
Right. Yeah. So it doesn't contain the additives and preservatives, and the 2 vaccines that are out are 95% effective when you receive both doses in the allotted amount of time that you're supposed to receive them. Put that in perspective for you. The flu vaccine that we often hear about sometimes can be as low as 30% effective. We have never gotten to 95. 90, we've never gotten to 95% effective, I don't think, with the flu vaccine. So if that gives you just a little perspective.
Angela, can you interject? I think you're sharing a point I'm not quite getting, but I want to hear it from the audience.
Yeah.
So the comment was that to clarify that the approved vaccines that you're talking about are those which are in the United States.
Yes.
Yes.
So apparently
The two
other
in the United States.
countries,
Yeah.
right, other
In other
countries aren't.
they do have others.
Yes. There are still so many in the works. There's so many that are coming out from different nations around the world, and we are only knowledgeable in this particular piece of the discussion about the two that are present in our communities in the United States. But hold on, folks who are global, thank you for your input. Please share, continue to share what's happening outside the United States. We love the insight. We actually got a point here. I'll talk about the UK one in a minute. Oh, okay, there are 3 vaccines currently in the UK, and there are some recommendations regarding those in breastfeeding people. And someone mentioned another that's being doing Novavax is doing trials in Ann Arbor, Michigan through veterinary the Veterans Hospital. So there's way more in the works beyond Johnson & Johnson. We'll hear about them as they continue to become available here and abroad. Thank you, Nikki. You were saying something else and I lost my thought, so I'll jump back in when it comes back to me.
No, it's okay. So the vaccine, and I know people have been using these token words like smart vaccine or clean vaccine, and it is what it is. Like, it's protein, some sugars in there, and it's in a saline. So they put it in your arm. Again, you get the 2 doses, and you go from there. Do you still need to wear a mask? Yes. Does it enter your DNA? No.
No.
Will you have a positive COVID test from getting the vaccine? No, not from getting the vaccine. Can you still get COVID if you get the vaccine? Yes. Here's the thing. One, there are variants. So we've heard about these variants. We've heard about what's happened in the UK where they had the variant and it's causing some problems. And then now the variant is in the United States. There are a variety of what we call strands, if that makes it easier to understand. There are different strands of it. You can still get it. However, just like with any vaccine, you know how some people say, I got the flu vaccine and I still got the flu. I'm never getting the flu vaccine again. Well, did you die? And that's the way we kind of describe it in the hospital when we're talking. We want to give it to you to build your immune system. That's not to say that you're never going to get it. Just like you get the chickenpox vaccine, or could you still get chickenpox? Yeah, you can still get the chickenpox. There's nothing that's 100%, and that's where that 5% comes from, where you we're protecting yourself, and you do have some antibodies in it. So if you do get it, you have something to help you fight it. Before, when we didn't have something to help us fight it. Even if you've had coronavirus before, do you still need to get the vaccine? Yes, because we don't know how long that immunity lasts. From what I was reading in the CDC, between 3 and 6 months, maybe, right? So keep that in mind as you're answering some of these questions for yourself, for your family, and then for some of your patients that have this. And please refer to the CDC has a toolkit online where you can go and get some of this information and give you some talking points, things that you can make posts about. The American Academy of Pediatrics has also posted some stuff, and ACOG. So go to your resources that we normally go to help us pull together evidence-based information and true science, and watch where you're getting. Avoid going to not necessarily news articles, but go to look down at the bottom, the references, and actually go check those references.
Yeah, we have a question in the chat about what do we mean by the technology's been around for a long time. So mRNA, messenger RNA vaccine technology has been around, I believe, more than a decade. And they have tested on various different diseases or viruses in terms of creating solutions to them. None of them made it this far. Why? Again, because of the devoted attention, money, billions of dollars being thrown toward this one versus other vaccines, time, attention, and resources being thrown toward it. So the technology has been around for a long time. Coronaviruses have been around for a long time. We know a lot about them. And so this is new only in the COVID-19 strain, but not necessarily new in terms of the science required to combat it. Someone says, is it true that if you get COVID a second time, your chances of survival are low? I have certainly seen people who get it a second time who have a much more severe case. I don't know if that's anecdotal or not. I think a lot of this is anecdotal at this point, but I wouldn't want to get it a first or second time. And we don't yet know when boosters will be needed because we don't yet know how long immunity will last. And that's all a part of testing this stuff in real time. So all of that was at the risk of sounding like a vaccine commercial. We just wanted to give you the facts about it.
Right.
What is this thing? Why did it happen so fast? You know, is it trustworthy science? We wanted to combat that first before we go into what does this mean for practitioners, for lactation supporters, and what does this mean for the information that you should be delivering to the folks that you serve.
Right. So I think the question comes to, do you see yourself as a public health provider? Do you see yourself working in the public health domain? And in a lot of our conversations, we have created this picture of ourselves inside of a public health domain where we interact with providers and we work as an interdisciplinary team, being that connection, their liaison to community members, and being that source of community health, right? So if you see yourself as such, is it your responsibility to protect your community at all costs? And I think that it makes you pause, right? So I will tell you from my personal experience, because obviously I can't tell you what to do. From my personal experience, it was a no-brainer for me to get this vaccine. I have gotten my first vaccine. On Friday, I get my second vaccine. It was a no-brainer. Number one, the population that I work with has a high risk of exposure. I work with the homeless population. So that to me, of course, I need to get it because I never know what I'm bringing. I don't know the interactions that they've had or anything like that. And now that's with anybody, but because of the population I work with, there's a higher risk. Number two is I don't know, again, I don't know what I could be bringing home into my space. And I need to be able to protect my family. I truly believe that I've had COVID before we even know that it was COVID, and I was really, really sick. And I don't want that to happen again. And also, I want to see my family. Like, I've been very clear to my family, there's no hugging, there's no visiting or anything like that. Now, everyone has their own rules and their own, you have to do what works best for your physical and your mental health, right? But for me, as far as me and my household, it's very nuclear. And I want to be a part of that. I feel like I have that responsibility. I'm going into people's homes and handling their newborn babies and handling these these healing bodies, which are parents that just gave birth. And I cannot risk bringing something into their home and while they're in this healing state. So that's my take on it and why I felt like it was my responsibility as a provider to uphold that do no harm.
Yeah. So Nikki comes from a community health clinician perspective. I come from a public health perspective, which is a little significantly different. But we both are very much concerned with the health of the general public and our communities, to be specific. And in doing so, we both felt that we have an obligation to get this vaccine. Interestingly enough, we've heard this amongst our peers who are anti-vaccine in any other instance, but they agree that this is a time when we bear a really important burden to be safe for the vulnerable populations that we support. I will share, I'll be wholly transparent in saying that I wasn't sure at first, not because I didn't trust the science, not because I thought it happened too fast, not because I thought that it would be harmful to me, none of those things. I had a really human reaction at first because I still have a nursling. And my human reaction was to protect my nursling at all costs. And so it's all well and good to shoot stuff into me, but I'm responsible for this little human, and I want to make sure I don't do anything that could ever cause them harm. And so that's what gave me pause. Of course, I'm beyond that now, but I'm still in Florida, where the doses have been administered to hospital staff and the elderly. And so regular old community workers like myself are not on the list of those who receive just yet, but I surely will. And we'll talk about why I'm no longer concerned about the harm it could do to my nursling. I'll be honest and say, I know you have questions. I know this is not comfortable for many of you. At a checkup for my nursling yesterday, the pediatrician was like, what should we be telling parents about this vaccine? Like, I don't even know how I feel about it. What should I be telling them? So I know these are questions. I know you're not, whatever question you have, you're not the only one who has it. Someone's already commenting or mentioning, I think a senator said, once you get the vaccine, you don't need to wear mask anymore. Please let me dispel that in this moment. You are still able to not only contract coronavirus, COVID-19, but you're also able to continue to pass it on to others after you're vaccinated. Real deal. What it is doing is helping you not to get as severe a case, and helping to hopefully limit your infection level and limit the amount of kids are loud in my ear, so I'm losing the words I'm trying to say. Limit the amounts of contagious, the level of contagiousness that you have. That is not a real word. Y'all know what I'm saying. So, but it's still very, very possible. My own two elderly parents have gotten their first dose. They'll be getting their second in a couple weeks. When they visit us, we will still wear masks. We will still socially distance, but we'll feel more comfortable about being in the space with them because we know that we are far less likely to cause them grave illness by having exposure to them. I hope that makes sense.
Yeah, that makes total sense. And you know, it's still going to take some convincing. I talked to my 87-year-old grandmother the other day, and she's like, "What you think about this shot? Am I supposed to get it? Because I don't like. I'm just too old." I'm like, "That's the problem. That's why you need to get it, because you're too old, and because you are in that high risk space." Someone said my concern about pregnancy and breastfeeding. So here's where the CDC, ACOG, AAP, all of them stand with that. Look, they don't do trials on pregnant folks and breastfeeding folks. If they did, then they would have an ethical issue at hand, right? So with that, we can only guess. We can only make an informed, guesstimate and say the risk of getting coronavirus. The benefits of getting the vaccine far outweigh the risk of getting coronavirus. And that's what they can say. They can say, based on the other vaccines that we've seen, this is the information that we can give you. Yes, some people have passed away from this, pregnant people. Does it affect fertility? They said that there's no reason it should affect fertility. Do any of the vaccines affect fertility? And so that's where we kind of have to go, where we've seen this kill in a year over 400,000 people. And to not be super passionate about it, like, what else we got, y'all? Like, and I'm almost about to cry, because what else tools do we have to fight this? We need to get in front of this. So I don't know what else to do, but you have to be safe with it yourself. You have to do your own research. The vaccine, one thing that a doctor said is that we should not try and put pregnant folks and breastfeeding folks in the same category, because they are not necessarily the same. The only thing that's the same about these two groups is that they weren't involved in any of the trials. The way in which it would be transmitted to a fetus or to a nursling is different. One through the breast milk, which goes into the gut, actually, which is very acidic, and one through if it does indeed go through a placenta. And those are things we just don't know. So, but they do recommend that healthcare providers that are working in COVID spaces, whether you're in the ICU or whether you're in a community clinic, they feel like the benefit is far greater than the risk.
Yeah, so this is tricky stuff, and you know, I know someone has commented that the recovery rate is 99.98%. I'd have to check that number. I'm not sure. I know it's extremely high. The overwhelming majority of folks who get COVID-19 recover. However, as Nikki has said, the number that have not recovered, those who have succumbed to the virus, are now 1 million worldwide. Is that where we are now? About 1 million worldwide. That's nothing to to dismiss. That is a real number, real lives that have been lost, and even more are going to suffer the devastating long-term effects of having had the virus. So what you consider to have been to recover is relative, because your recovery could mean you're a long hauler, could mean you have issues much later in life that we have no way of knowing right now. And so that's a consideration when you're talking to your parents, and if they feel like, oh, well, it's not a big deal, most people recover, we're healthy, we're young. There's countless stories at this point about young healthy people contracting the illness, but it's not your job to convince your families. That's not the position you should take on, but it is helpful to have really good information from solid sources. And we talked about fake news versus sources that are reliable here in these webinars, and we'll continue to do that. We'll continue to show you places where you can get information that is reliable, that is science backed. And we've got to keep saying, the field that we're in, if you are a lactation supporter professionally, then you have left kind of the realm of, oh, I just, I do support groups in my community and it's really great and it's free. You've gone into a professional realm wherein you are bound by science and codes of ethics and evidence-based practice. And we cannot then also, we can't teeter on whether or not we trust, whether or not science should be an underpinning of our practice. We really have to be really clear about that. The decision is still up to you in terms of if you want to vaccinate. I'm not telling you to tell your parents, your families to vaccinate, but I am telling you that the science should be important to you as a practitioner who does this for a living. So Nikki, I think you talked about, and I was reading comments, and so I want to make sure I didn't miss it, the difference between what you would counsel folks who are pregnant versus folks who are breastfeeding.
Right. And it looks like frontline workers, pregnant and lactating people were participating in clinical trials, but I don't know if they weren't, but they were frontline workers. I do know several pregnant folks that have received the vaccine. They are on the COVID unit, and they were like, look, I've seen it firsthand, and I didn't, of course I'm putting, it is what it is. Like, I know that people are dying from this, and I would feel more comfortable if I had an added layer of protection for myself. So obviously, remove all of my passion and bias that I'm giving you, is that it is obviously your responsibility as a public health professional to do your research and do well enough research. So if you are questioned by your clients about whether you received the vaccine and why, or what are your concerns about the vaccine, or, in addressing theirs, so you can come with the goods, come with the information, come with the truth about and seeking truth sources, right? So the CDC, our entities that be ACOG, AAP, and things like that, and not, the truth is not senators and legislative folks, and even the president, regardless of who our president is. I'm getting my information from the source. So news sources, I'm not getting my information from them. I'm going straight to the evidence-based sources. So that's what I encourage you to do.
Can you share that quote from the AMA that we talked about before we got on?
Oh, yes. So the AMA had a quote, and they were talking about, I'm sorry, about provider responsibility with COVID. And I want to hear what y'all feel about that as well. I'm sorry, I had it up, but it's disappearing now. And how y'all feel about what you think your responsibility is.
Yeah.
It's not coming up.
In a second. All right.
This computer.
While she's doing
I'll
that,
find it.
I'll see. Angela, please continue to share thoughts. Nikki, I'm going to share that link to the toolkit in the chat.
Mm-hmm.
That Google Drive document. So one thing that folks are asking is if there are resources that they can share with their communities to help them better understand, or especially marginalized communities where folks may be hesitant to take the vaccine. If you find yourself in a conversation like that with your community, I'm sharing a link to a toolkit. It has some really cute videos, Google documents, vividly illustrated documents that you can print down and share with the community. And I think that may be helpful if you're trying to help people better understand the COVID-19 vaccine. The other piece, as Nikki has shared, is that we really have an opportunity here to have conversations with our communities that we've not had before. When we're talking about this vaccines, folks ask us a lot of stuff about a lot of different things, but to be able to be a trusted person in your community, for them to ask you about something that really is impacting all of us so drastically, I think is a really great place to be. I think you should feel honored if you're in the position in your community to be a person to educate on this topic. Again, folks who are pregnant, the evidence does not show there's any reason for concern. However, we can respect the fact that some folks want to be extra cautious, as I was at first about being a nursing parent, right? And so we respect that. They have lots of options. They can choose to vaccinate right then during pregnancy. They can choose to be, extremely careful and vaccinate immediately after pregnancy. They can choose to, wait until some other point in the future. They have options, but arming them with information is the key. Folks who are breastfeeding should be assured that so little, thank you, sorry for putting that in the chat. Folks who are nursing should be empowered, encouraged with the information that, one, mRNA vaccines go right into the site and are dispersed through and out of your system within hours to days at the most. They do not hang around. Like Nikki said, they do not contain any of the virus. They do not have any way to, put COVID into your bloodstream. So there's not that would get through to baby through the milk. What gets through is, some, if anything, antibodies that you create. And then if any portion of the vaccine, which is again highly unlikely, if any portion of the vaccine made it through to your blood, it would then be taken care of in baby's gut. And then again, would not cause them any harm whatsoever. That we can say with some degree of certainty because of how we know vaccines work and because we know how baby's gut works as well. That should be much less of a concern. Nikki, did you find this statement? Is it still hiding?
Mm-hmm. Yes, I have it. Sorry, y'all. It said physicians and other healthcare workers who decline to be immunized with a safe and effective vaccine without a compelling medical reason can pose an unnecessary medical risk to vulnerable patients or colleagues. Physicians must strike an ethical balance between their personal commitments as moral individuals and their obligations as medical professionals. So that's kind of where, before even seeing this statement from the AMA, the American Medical Association, I knew that I felt like it was my moral obligation to get this. And one of the things that when I came home, like my husband was like, good job for taking one for the team. And I always thought that he was saying that because he didn't want to get one, but he was like, no, like, your community, like taking care of your community by stepping up and doing something, that other people aren't really on board with doing it, but you're like, you know what? I'm out here in these COVID streets and I want an added layer of protection for myself and for the people that I interact with. So
Yeah, I'd like to also speak to the equity issue. Let me be clear.
yes.
Nikki and I are very aware of the challenges with marginalized communities in terms of lack of trust of the medical establishment. I just, hot off the press, wrote a peer-reviewed paper with some colleagues on this matter and how this goes back centuries, and it is real and it is impacting our nursing decisions today. Fear of distrust of the medical establishment because of the harms that have been perpetuated for generations upon people of color, used as test animals, test subjects, for medical research, and inflicted with so much harm to the point where it's irreparable in some ways. We get that. We know that is real. This is not that. I'll be clear on that. This is not that. I read an interesting article by the children of survivors from the Tuskegee experiment. And if you're not aware of the Tuskegee experiment, please look it up. In that case, Black Americans in Tuskegee, Alabama, were withheld treatment for syphilis. They were told they were getting treated, they were not being treated, and they were, instead their reactions and progression of the disease was being watched and studied. That was a case of medicine being withheld from this particular group. What we have here is a very different scenario wherein these vaccines are the hot ticket right now. There are folks from dominant culture, from wealthy neighborhoods, finding their way over to the poorer people of color neighborhoods where the vaccines are available, and standing in line and taking their places because it is a much coveted relief in this moment. I won't go into what their motives will be, whether they're trying to stay healthy to travel or what. But I will say the ulterior motives are present in the opposite direction this time. In trying to, everybody's trying to get, or so many people are trying to get access to this. That there's no way that this is a concerted effort against a particular community to cause harm. That would have to be something orchestrated at a level to which it's not possible in this way. I mean, it would have to be orchestrated on such a grand and global scale to create this vaccine to do harm to every marginalized community in every nation, like that. It doesn't track. This is not that. This is actual public health science happening to help the general public, everybody, be better off from something that we did not, some saw it coming, but we certainly weren't prepared for.
Yes. Woo.
I know. Sorry.
No. No. It was no. Yeah, a pause was necessary. Because that is real. Like, the fear is real, and I know we've seen some folks that are like, oh well, the first person that they vaccinated was a Black woman. Like, they just want us to get the vaccine. They're trying to pull us in. And, however we look at it, more Black folks died from this than others. And it just doesn't add up, if we don't get the vaccine to help ourselves. Like, we have to do something. Everyone, I believe, should get the vaccine if they are able. And that is my belief. That is not, the belief of LER or Nikisha Killings or anyone. That is Nurse Nikki. That is what I believe, because I have seen death with this, and I've experienced some of the effects of the virus. So that is my belief. I do encourage you, once again, we can't say this enough, to please do your research, do your due diligence. Just like we research, if a parent contact us about tongue tie, we gonna give them the best research that's out there. We're not going to a blog to pull something from. We're not going to a newspaper article. We are pulling stuff from the best places we can so they can make an informed decision. And that is what I challenge you to do for yourself, for your family, and for the families that you serve, before all else. So, any other
Absolutely.
content?
Someone mentioned that pregnant people are at greater risk for COVID than for COVID related complications. Absolutely.
Mm-hmm.
Absolutely. Just as, when you're pregnant, you're more likely to get all the other things, all the things.
Right.
Your immune system is just a little wonky, as you know, during that time. I've shared a couple of other articles into the chat. Thank you, tech folks, for sharing those more broadly to the audience. But we try to do due diligence for this conversation. We try to look into what all the major medical bodies are saying right now. What are the researchers saying? What does the science say? So that we didn't just bring you our opinions. We wanted to make sure that you
Right.
knew what the facts were. It may have sounded like our opinions because we certainly are on the side of science in this. Not to imply that you are not if you are still hesitant. I want to be clear. And we had a question before we even began today. Someone said, how will this conversation be experienced by folks who are anti-vax? It may have been uncomfortable, but it was our intention to share with you the facts as they relate to the science around this topic. And we're sharing amongst colleagues who should value science as well, who should value what the data says in terms of the risks and what our authorities are saying about what our responsibilities are as providers. I hope that we've done service to that. Any other thoughts, Nikki?
No, okay.
All right,
I
we're
think
still
I
taking.
poured out more
I
than I
know.
wanted to.
we shared a lot today, oversharing. But we thought it was important to tell you where we were personally in this and to share where there was doubt and where there was concern, where there's hesitance, because we know that that's also the sentiment globally. We know that no matter where you are, even if you're in a country where this thing has kind of been handled, that there's still some, reluctance to understanding, how to best go about supporting families. And we're very thankful that folks are from all over the world representing those various viewpoints. Please communicate to us in the chat. Let us know if you have any other questions, any other thoughts, anything that you want us to bring forward, so that we're just not just sharing our opinion, our research today. We want to make sure that it's a conversation as always. Can someone speak to the safety of the vaccine for breastfeeding people and their baby? I thought we had, but perhaps you're just joining us. So we'll make sure we drive that one home. We have shared an article in the chat as well. Make sure you check that out. It talks about the recommendations having been a little bit off so far for lactating folks. What we know for sure is that the vaccine does not contain the virus. I want to make sure I understand. Yeah, it does not contain the virus. And Nikki loves to talk about how clean the vaccine is. You want to jump in and tell me why is it cleaner than a flu vaccine? What does that mean?
Well, the flu vaccine contains a weakened version, and some a weakened version of the flu, right? Or a dormant version of influenza, whereas this one doesn't actually contain the vaccine at all. It takes a step back and it contains the instructions on how to create the spiker protein. So when you get that first dose and then you get a second dose. So some people may say that they're getting sick from the vaccine, like they're like, oh, I had fever and chills and stuff like that, and it usually happens on the second dose. Well, because you had those instructions on you in that spiker protein, and then you get more stuff, you have what we call an immune response. That immune response can last anywhere from 24 hours to 72 hours. But you should start feeling better after that. And that's the response we want you to have. That means your immune system is doing exactly what it should be doing. If you had that response on the first vaccine, guess what you had? You already had some antibodies. You already had some antibodies in your system. That means you had some level of exposure to it. And then we still want you to get that second vaccine because that is the full gamut. So, in getting that, you are just with other vaccines protecting yourself. You're going to create those antibodies, and hopefully, we're passing them on via our breast milk to the baby.
Yeah, for anybody who gets the flu vaccine, you may remember, or maybe not, that first time you get the flu vaccine, you have to get a booster within 30 days because the first time you get it, it starts to kind of awaken your immune
Mm-hmm.
system, but it certainly isn't as effective as it should be until after that booster. And then from then on, you just need one per season. This is a very similar effect. Of course, we don't know how long a season will be with this, but it is to based on all the science available to date, safe for lactating persons and their nurslings. I will be direct in answering your question. Safe. We believe it to be safe, mostly not because it's been studied in lactating persons, but because what we know about it, it doesn't track that there's no root for harm. There's no root for harm that we're aware of in terms of the vaccine being harmful, nor any pieces of it that may get to the nursling being harmful at all. And I hope that answers your question. Someone
Yeah.
asked if taken, is the vaccine protective against new variants? Some. I think there's a South African variant that's giving some of these vaccines the blues. It's the vaccines are less effective against it. But there's reason to believe that getting one of the vaccines that are widely available in the country that you live in today poses some resistance against um, uh, all the strains that are out there. Some are just a little bit stronger in their approach, so you have a greater likelihood of contracting the illness. But again, we're talking about minimizing the effects of it once you do. I hope that makes
Mm.
sense. Um,
Oh, what do you think about the similarities between this viral experience versus the immune response to the vaccine? So we just don't know how long the immune response from actually having the thing, how long those antibodies stay in your system, right? So, like I said, truly believe that I had COVID at the beginning of March of last year. Well, obviously, I just had my vaccine, 2 weeks ago, but I still had a response as if I've been exposed. That means that I have been exposed again within, they said, the last 3 to 6 months, which I'm not totally surprised, but that is what it is. So just because you've had it doesn't mean that you necessarily, are totally immune to it. Again, getting the vaccine provides a longer length, what we think. Now, we should have had a disclaimer at the beginning. We are not microbiologists, but we are
or
people that,
epidemiologists.
or epidemiologists. We are people that are reading and researching and trying to make sure we have the greatest wealth of information for our particular discipline and just slightly beyond that, so we can
Sure.
kind of chop it up, disseminate it, and give it to you in a way in which lactation folks can use it and spread it, right? So the vaccine is a longer immunity. We don't know how long that immunity is. We do know it's for at least a year. Do we need a booster? We're not sure yet. But obviously, as this is developing, with COVID developing and how to treat it, like we didn't even know how to treat it at the beginning because we weren't even treating it effectively in March, you know? And so they finally figured out ways. And then the same is going to be true for as we roll out this vaccine and all the different variants, because a variant can pop up here and anywhere, and it'd be a duplicate of a duplicate, and we just don't know. So there are so many ways, and we just have to kind of have some generalization about this, and obviously there will be situations outside of the box.
Yeah,
uh,
I interestingly enough, I think this is the story for a lot of us, but I
mhm,
too believe I had it. But it was late January of last year after I returned from the California
mhm,
Breastfeeding Coalition conference in Sacramento and flew with
mhm.
my 6-month-old. And we were very, very, very sick after
Very
returning home
sick.
from that conference,
Yeah.
and the sickest I've ever been in my life, which is, I am generally healthy, so it's not as bad as what we hear, or we're hearing about some of the worst cases, but it certainly was the sickest I've ever been. I've never been not able to breathe or complete a sentence. And to this day, I'm suffering a little bit of the effects of it
Mhm.
still, which is why I think I may have had it. I still, you know, the systemic harm that this disease causes in those that it hurts bad is not worth it to me to chance that again. I would for sure like to be vaccinated instead.
This question, it says, for those who have compromised immune system, should they take additional measures before getting the vaccine? That's a conversation to be had with your provider. Who has ever following your care, you need to have that conversation with them, because it is not, and what I've told patients in the past, you know, folks that are HIV positive or have sickle cell anemia or are undergoing chemotherapy treatments, they cannot receive live vaccines. Well, this is not a live vaccine. So in the past, that group has actually been encouraged. If there's a vaccine, y'all need to get it. But for this vaccine, I want you to talk to your provider and just make sure that you're having, you know, a conversation of, hey, these are my questions about the vaccine. I know my personal situation. Should I get it? And I thank you. But for sure, we don't. And here's the thing: we don't have to have all the answers, and we're not going to have them, because this is not our lane. Our lanes are breast and breastfeeding and infant feeding and those things like that. So we may not have all, we may have to dig for it, or we may have to say, you know what? I actually am not sure. I can do a little research, but I also encourage you to talk to your healthcare provider if that's possible. And it's not uncommon for the healthcare provider not to know, because literally this is changing day by day as we get. It's like a news brief every
Yeah,
few minutes, or an article. So please be as fluid with your giving of information as the folks are in giving it to us. Like,
absolutely. As you are awaiting, if you're waiting, if you're, you know, trying to decide, if you're in a place where it's not available, all the things, we absolutely encourage you to do all the things you can do to stay healthy, though. You know, in
mhm,
addition to PPE, you know, making sure you got your vitamin D and your magnesium and your zinc and your, you know, all the things, uh, elderberry, you know, all the things that you
mhm,
would normally do during cold and flu season to keep your immune system as strong as possible. Absolutely do those things right now. Do them in
mhm.
addition to your PPE, as long as it takes until we're out of the woods and in a different place. Even if you vaccinated, please continue to do
Please
all the things
continue.
to protect those from something you may not even know you're carrying then in the future. Woo, that was a lot.
That was a lot, y'all. Thank y'all so much for for tuning in and being open to conversation
Yeah,
and just community sharing. Uh, this is not over, and we still have work to do. And we're here to help you navigate these lactation streets.
yeah. I mean, we spent our first, I don't know, dozen or so of these webinars talking about COVID and what you can do to respond to it. So that, you know, we're not new to this. We appreciate the opportunity to always come before you with what we know. Y'all know us by now. It's real talk. It's from where we live and the
Mhm.
experiences that we've had, while also trying to honor you and your own experiences. So we thank you for trusting us to share this today. We thank you for coming in, and hopefully you learned something that equips you to be a better resource to the parents that you're serving.
And
And
if you
we'll
want
be
to keep the conversation going, please follow us on our social media outlets. On Instagram and on Facebook at Nikki and Nikki IBCOC.
absolutely. We'll be putting together a resource sheet with all these resources, and we will share that out within the next couple of days. It'll take us a few days to get that worked up, but we'll
Yep.
get that out as well so that you can have a handy dandy place to pull information from as you need it. And we'll work to continue to update that as new and greater information is
Yes.
available. Until then, thank you again for being with us. Please join us in 2 weeks
On
for
February the
breastfeeding,
17th.
February 17th, for breastfeeding after dark. What's that, Nikki? What's that?
We are going to be talking about breastfeeding and intimacy. It's a much lighter note and it brings excitement to me as well, but in a different way.
Different
So
energy that
please
week,
tune
different
in. It's
energy.
a different energy, which is so much lighthearted. And so please bring all your antidotes and your listening ears and your notebook and stuff, just so you can, because this comes up in our lactation visits, and we just want to be able to guide clients through this, but we have to guide ourselves through it as well. So we hope you'll
Indeed.
join us next week. Until then, stay safe,
Stay
stay
sanitized
sanitized, and stay sane
as much as you can, as much as you
as
can.
much as you
That's
can.
fine. You know.
All right, y'all.
See you next time.
Bye.